Ever wondered what integrative medicine is all about? A fascinating field, integrative medicine is a harmonious blend of modern science and age-old wisdom, aiming to nurture the whole person, body, mind, and spirit. A compelling approach that's more than just treating symptoms, it zeroes in on the root cause of illness, promoting health and preventing disease before it even starts. Integrative medicine takes into account your physical health, yes, but it goes beyond that. It recognizes the significant role of mental and emotional well-being, as well as the impact of social aspects on your health. It's a holistic approach, where traditional medicine is beautifully entwined with complementary practices like acupuncture, yoga, or herbal medicine. This approach is not about replacing conventional medicine, but enhancing it, creating a patient-focused, personalized healthcare plan where you are an active participant in your health journey. Imagine a health approach that takes into account not just your physical state, but your emotional, mental, and social health too. Think about the last time you visited a doctor. What was the experience like? In many cases, it likely involved a brief consultation, an examination, a diagnosis, and a prescription. This is the cornerstone of traditional medicine, where the primary focus is on identifying and treating the symptoms of disease. You have a headache, you get pills for pain. Your blood pressure is high, you get medication to lower it. You have an infection, you're prescribed antibiotics. The pattern is familiar and, to a large extent, effective. Traditional medicine has been the bedrock of healthcare for centuries. It's grounded in rigorous scientific research and clinical trials, and it has saved countless lives. But it's primarily reactive, responding to ailments as they manifest themselves. It often overlooks the complexities of the individual patient, their lifestyle, their environment, their psychological well-being. In traditional medicine, treatment plans are usually centered around medication and, in more severe cases, surgery. These approaches can be highly effective, but they're not without their drawbacks. Medications can have side effects, some of them severe. Surgery, while often necessary, is invasive and carries its own risks. Moreover, these treatments often address the symptoms of disease rather than the underlying causes. They can alleviate discomfort, but they may not get to the root of why you're feeling unwell in the first place. And let's not forget the impersonal nature of many medical interactions. In a world where doctors are often pressed for time, the patient-doctor relationship can feel transactional. You're in, you're diagnosed, you're out. It's a process that can leave patients feeling unheard and uninvolved in their own healthcare. With traditional medicine, the focus is primarily on treating symptoms, often with drugs or surgery. But what if there was a different way? A way that didn't just treat the symptoms, but also addressed the root causes of illness. A way that considered the whole person, rather than just the disease. That's where integrative medicine comes in, and we'll explore this fascinating approach in our next segment. Now, consider a different approach, integrative medicine. What sets it apart from traditional medicine? Well, the answer is layered, just like our health. In the realm of traditional medicine, the focus is often on treating the symptoms. You have a headache, you take a painkiller. You have high cholesterol, you're prescribed a statin. It's somewhat a game of whack-a-mole, with the aim of silencing the symptoms as they pop up. On the flip side, integrative medicine takes a holistic approach. It's not just about treating the symptoms, but about understanding the root cause. It seeks to understand why that headache or high cholesterol exists in the first place. Is it stress? Is it diet? Is it a lack of exercise or sleep? Integrative medicine aims to answer these questions and more. Moreover, integrative medicine places a significant emphasis on prevention and promoting good health. It's the art of keeping the body in such a state of wellness that diseases find it hard to take hold. It acknowledges that our bodies are capable of self-healing and self-renewal, given the right conditions. Integrative medicine also leans towards natural, less invasive interventions wherever possible. This could be in the form of nutritional advice, lifestyle changes, herbal medicines, acupuncture, and other therapies. The idea is not to wage war on the disease, but to gently guide the body back to its natural state of balance and health. Now, one of the most distinguishing factors of integrative medicine is the emphasis on the doctor-patient relationship. It's about partnership, empathy, and mutual respect. An integrative doctor spends time with the patient, listens to their story, understands their lifestyle, their fears, and their goals. They work together, hand in hand, on the journey towards health. So you see, integrative medicine is not a mere alternative to traditional medicine. It's a different philosophy altogether. It's a shift from a disease-centered approach to a patient-centered approach. It's about empowering individuals to take charge of their health and live their best life. Integrative medicine is about more than just treating symptoms. It's about promoting overall health and prevention. So, what makes integrative medicine so appealing to health enthusiasts and patients alike? Well, the allure of integrative medicine lies in its multifaceted approach to health and wellness. It's a holistic model that goes beyond just treating symptoms. Instead, it focuses on the whole person, their mind, body, and spirit. This means that it doesn't just look at what's wrong physically, it also takes into account mental and emotional factors. It's like having a team of doctors who look at you from all angles, ensuring nothing is overlooked. The beauty of integrative medicine is that it's not a one-size-fits-all approach. It uses both conventional and alternative methods, providing a more comprehensive and personalized treatment plan. This could include anything from prescription medication to acupuncture, from surgery to meditation. It's about finding what works for the individual, not just following a predetermined path. Another compelling aspect of integrative medicine is its emphasis on patient empowerment. It encourages patients to play an active role in their health. This could mean learning about their condition, understanding different treatment options, or making lifestyle changes. Patients aren't merely passive recipients of care. They are active participants in their own health journey. And let's not forget about preventive care. Integrative medicine does not just focus on treating illness, but also on preventing it. It promotes healthy behaviors and lifestyles, aiming to keep diseases at bay before they even have a chance to develop. This proactive approach can lead to fewer doctor visits, less medication, and overall a healthier, happier life. Integrative medicine, with its focus on the whole person, its use of a broad range of therapies, and its emphasis on patient empowerment and preventive care, offers a refreshing and more comprehensive approach to healthcare. It's a model that respects the complexity of human beings, acknowledges the interconnectedness of our bodies and minds, and recognizes that each person's health journey is unique. In the end, integrative medicine aims to empower patients, enabling them to take control of their own health. To summarize, integrative medicine and traditional medicine offer different approaches to health and wellness. Let's take a moment to recap the key points we've discussed in this conversation. Integrative medicine, as the name suggests, integrates or combines both conventional and alternative therapies to address disease and maintain health. It's a holistic approach, focusing not only on physical symptoms, but also on the mind, body, and spirit. It emphasizes the relationship between the patient and physician, and is informed by evidence, making use of all appropriate therapeutic approaches to achieve optimal health and healing. Traditional medicine, on the other hand, often referred to as Western medicine, relies heavily on the scientific method. It's primarily centered on the diagnosis and treatment of health conditions, often focusing on the disease itself rather than the whole person. This approach has been incredibly successful in treating a wide range of acute health conditions, and it's the backbone of most healthcare systems around the world. The differences between these two approaches are clear. While traditional medicine excels in treating acute conditions and emergencies, integrative medicine shines in its comprehensive approach to health and wellness. It's not just about treating disease, but about promoting overall health, preventing illness, and improving quality of life. Let's not forget the benefits of integrative medicine we've explored. It offers personalized care that is tailored to the individual, recognizing that each person is unique and requires a different approach to health. It also fosters a collaborative relationship between patient and physician, encouraging active participation in one's own health journey. Plus, it emphasizes prevention and health promotion, rather than just disease treatment. Remember, the choice between integrative and traditional medicine is not about which is better, but about which approach aligns best with your personal health goals and philosophy. It's about finding the balance that works best for you and embracing a health strategy that supports your overall well-being.